Okay, we're going to be filming the Foley catheter insertion using the modular trainer at home. This is what your setup should look like, but I'm going to go over each piece with you. So these are the pieces that you're going to need for from your modular trainer. This hard headpiece, the face, and then I'm going to put those two together. So these little flanges by the ear on the face right here, they're going to go into this hole right in front of the ear with the forehead facing up towards the rounded edge, of course. And you'll do that on both sides, and you'll just pull that through the holes. Like so. And that's kind of what it should look like from the front. And then that's what it'll look like from the back. I've got my bed pillow here, and then I've just got a small pillow in front of that. And that is just where I'm going to place my head, okay? The big base will be in front of that, and then on this smaller piece here, this is where we're going to put the female genitalia. And you'll see here, this is this big rectangular, well, this is a bigger one, but the rectangular hole here that's at close to the rounded edge, you're going to put this rectangular piece into that. Now, there's not enough room between this rectangular piece and this protruding part here. So you're going to have to hold that down as you put this into the modular trainer for it to fit. So just get that in there. Hold that down, and this bottom piece is going to slide right into that at the bottom. So this is what it should look like from the front. And this is what it should look like from the back. And this will go at the top of your modular trainer. So now that we have our patient ready in her bed, then I'm going to go and look at my orders and get my supplies. So I've reviewed my orders, and I have an order for a Foley catheter for Miss Famous Fanny. And if you'll notice on your critical, one of the critical parts is that we provide pericare if needed. So if you have not been in your room already and know that you have towels and washcloths, a basin and soap, then you would need to gather all those supplies and take in with you. You'll also need a Foley catheter kit. This is my Foley catheter kit. I've examined it. It's in good condition. It has not been opened. It is within date. On this Foley catheter kit, you'll see that it will tell you the size. It is a 14 French. It also says that it needs 5 milliliters to inflate the bulb. And so we'll need to know that later on. And so I'm going to gather all of my supplies. I'm going to come to the patient's door. I'm going to knock on the door. They said, come in. All right, hold on. Let me go close my door so I can get rid of this barking. Okay, sorry about that. I have one good dog and one bad dog. I guess you can tell which one's the bad dog. All right. Knock on my door. My patient said, come in. I am using my foam hand sanitizer. I'm coming in the door. Good morning. My name's Donna. I'm going to be your nurse today. Can you tell me your name and your date of birth? And so I'm comparing the name and the date of birth that the patient has given me with the armband, and it does match, and it is Famous Fanny. Miss Fanny, we are, how was your night? Good, good. She had a good night. So, Miss Fanny, your provider has ordered, your doctor has ordered that you have a Foley catheter put inside your bladder to help drain the urine. Is that okay with you? And she said that is fine with her. Okay. So at this time, Miss Fanny, I'm just going to look and make sure we don't need to clean up down here. Is that okay? She says that's okay. And so I'm inspecting the peri area. She's good and clean. So we will not need to provide peri care at this time. All right, Miss Fanny, I'm going to go ahead and leave you exposed. I'm going to bend your knees up. And then you'll have the patient bend up their knees. This is the lithotomy position. And so you want to make sure that you uncover her, you pull her gown up so you'll have a good area to work in. And that you won't, once you become sterile, you're not able to touch those things again. Okay? So make sure you have a good working area. All right, so the first thing I'm going to do is I'm going to open up my Foley catheter. You see here that I'm turning back the end of this bag, and the reason I'm doing that is to try to get it to stand open, because this is where I'm going to put discard of some of my garbage, okay? Let me make sure you can see that. Okay, good. I won't need this, or if I needed to keep this to get the size of my catheter, you could put it over here on your bedside table, or you can discard it. Now we're about to have a sterile area, and so you'll see here that this is bent back. And we're going to pull that away from us. Now, I'm not over this like this. I am going to be to the side and pulling this back. Ideally, we would put this on an overbed table, but I don't have an overbed table at home. And I'm just doing this to show you what technique to use, because you do not want the patient to touch any of this. I'm going to pull this side down, this side open, and then this side open. This first piece we will not be using. This is a fenestrated drape. We will not be using that. I'm going to drop it in the garbage can I have right here. This second piece is another drape that we're not going to use. But this third piece is the drape I'm going to use. And I want you to watch me pick this up. I'm picking it up from the edge. And I'm only touching this other edge. Now this has, I don't know if you can tell on the video, but a shiny side and then a dull side. And so I'm going to put the shiny side down right here on the bed. Okay? And if you need to manipulate that any, because you're going to have, you know, on a real patient, you're going to have the legs up, then you'll just need to come around here and do so. Just make sure you're not going over this sterile field. And you're not going over this sterile field. And ideally, like I said, you're going to have this over here so you wouldn't be over it. And I didn't touch that with my hands. We'll put it back. Pretend that didn't happen. All right, now I'm going to just move my sterile gloves over here. And I'm going to go ahead and put my sterile gloves on. I don't know if you can see this, but I'm putting my fingers under this folded back piece and just pulling. I'm not over my sterile field, okay? I'm just over here on the side. I'm going to glove my dominant hand first. I'm right-handed, so I'm going to put that on. I do that by grabbing the cuff that's turned up on itself. And then I'm going to slide my hand in. Now you see, I didn't do a great job with that, okay? But that's okay. I can fix it once I'm sterile. And don't worry about, like, if you want to pull this down, that's fine. But if you get to this, don't mess with it. It's going to be fine. Now what I'm going to do, I hope you can see this, is I'm going underneath this cuff. These sterile gloves are old. You can see them yellowing. And now I'm sterile on sterile, and then I'm putting my hand in this one. Now I can fix this hand. I hope you were able to see that. And then if I want to get this out of the way, I'm just going to do that. Once you become sterile, you have your sterile gloves on, hold your hands up like this. We would have pulled the patient up to above our waist, because anytime your hands go below your waist, that is they're considered contaminated. But I do not have the ability to raise my bed at home, but we would raise the patient's bed to a comfortable height. By the way, my back is hurting right now because of the bending. So make sure you're doing that and taking care of yourself, okay? All right, so now I'm sterile, and I can get back over my sterile kit. This hydrogen peroxide we're not going to use. You may, in your kit, have some provolone iodine solution, betadine, or you may have some swab sticks. So either one, what you're going to do is I would open this. I'm going to pour this over my cotton balls, discard. And if you'll notice, I'm going around my sterile field to discard, okay? The next thing I'm going to do is I'm going to open my lubricant, opening it, and I'm going to squirt it in this side part right here where I'm going to put my catheter. I'm going around my sterile field to get rid of that. All right, now I'm ready to place everything. So I'm going to place this up here next to my patient and my Foley catheter right here. This is all on my sterile field, okay? Now I'm not worried about this area anymore because I'm done with it. So the next thing I'm going to do is I'm going to connect my syringe with my solution onto my catheter. You'll see here that there's a port where the tubing and the catheter connect. There's an extra port. This is where you're going to insert this. And I'm gonna take this off now. Discard of it. And I can inflate the bulb to make sure it's good and has no leaks or anything like that. Your facility and your the products that you use at your facility will dictate whether or not you do that. Some do and some don't. So then I'm just going to lay my catheter in my lube, making sure not to touch the patient's skin. All right, now I'm ready to touch my patient's skin because I'm about ready to clean. So with this hand, my non-dominant hand, I'm going to hold this labia open. I'm going to pick up either my swab sticks or a cotton ball that has my cleaning solution. I'm going to go and clean the labia side furthest away from me. I'm going to come around, not over. I'm coming around my sterile field, discarding. I'm going to clean the area closest to me, the labia closest to me. I'm coming around my sterile field, discarding of the cotton ball. And then I'm going down the middle with my last. Coming around, discarding, and I'm through with that. Now that I have my lube on my catheter, I'm going to insert this into the vagina 2 to 3 inches. And you may need to use a twisting motion to do that. And you're going to go 2 to 3 inches or until you see urine come out. So once you see urine, you're going to instill a little bit further. You're going to inflate this bulb. If you can. If you can't, that's okay. Take that off. Discard of it. Then I'm going to pull on that to make sure it did indeed inflate. You'll feel a little bit of a resistance there. 2 to 3 inches is what we would insert the catheter for a female. 6 to 8 with a male, okay? Okay, so now I'm ready to let go. I'm going to take these gloves off. I'm going to put on some clean gloves. So I'm ready to then take my Foley catheter. And if you needed a specimen, this is what you would collect your specimen in. But we were not told to get a specimen on this one. Usually you will, though. Okay, so now you see you unroll, you untwist all of this. You will tape this catheter to the inner thigh using whatever securing method that your facility uses, okay? A lot of times there's a locky little pad that you put down that has a lock on top of it that you can put this part of the Foley catheter in that'll just lock it in place right there on the inner thigh. So secure that to the inner thigh. And then I'm going to use these 2 little flanges here. You may have 1, you may have 2, depends on what kind of Foley you have. I'm going to open these up and I'm going to secure this on the part of the bed that is immovable. So it's the bed frame, not the side rails, and it's got to be lower than the level of the bladder for it to drain, okay? I've got it secured there. I'm going to clean up. I've got my gloves on, remember. This is going to go into a red garbage. I'm going to make sure I cover my patient back up. Miss Fanny, how are you feeling? Was that okay? She said it was fine. I'm going to put her in a position that she is most comfortable in. I'm going to put the bed in the lowest position. I'm going to put both side rails up and make sure that her call bell is within reach. I do need to come down here and look at my Foley catheter, how much has drained into it. I need to note that because that's part of my documentation. I need to document what size the catheter was. It was a 14 French. How much was used to inflate the balloon, 5 milliliters. We used a sterile technique. Patient tolerated it well. We had return of 200 milliliters of yellow urine. So I'm documenting the size of the catheter, how much was used to inflate the bulb, the urine that was returned, the amount and the color, and that we used sterile technique. The last thing we would need to do would be to verbalize that we're going to initiate intake and output record. Now that's the last thing on this checkoff list, but if you don't say that, we cannot check that box. So be sure to say that you're going to do that. I would then take these gloves off, perform hand hygiene, and then go document those things.